2025. And so you all will receive notice when the next date is decided, and then you won't have to register again. Um, there's a question and answer section here where if you have questions during the presentation or comments that you want to make, you're very welcome to. There's a chat area where you can chat during the presentation and make comments. And then at the end of the presentation, there will be a time for question and answers. We will also be recording the session so that it will be available. So without further ado, I will introduce the topic and our presenters. So the topic of the presentation today is a career in pediatric oncology social work, the joys and complex challenges for medical social work practitioners. And then our guest speaker today is Alistair Robertson, and he's been a pediatric oncology social worker for more than 32 years. In the last 22 years, he's been at Valley Children's Hospital. He completed his bachelor's degree in social work at Tabor College and his master's of social work degree at the University of Kansas. Alistair has been an active member and served on the board of directors of the Association of Pediatric Oncology Social Workers, presented at their national conference, and received the APOSW Social Worker of the Year Award in 2016. Alistair served as an adjunct professor at FPU in the social work degree completion program from 2016 to 2021. Alistair is passionate about working with patients and families of children, adolescents, and young adults diagnosed with cancer. Alistair enjoys traveling and spending time outdoors. And as you can see, there's also a person with him as well, and he will introduce her. But she is an intern and works is at Valley Children's right now, and will be able to offer some insight as well. So thank you so much for joining us today, and the floor is yours.
Wonderful. Hey, thank you, Dr. Clark, for that generous and kind introduction. It's a pleasure and honor to be here with you all today to share a little insight as to the role of the medical social work. And with me today, like Dr. Clark said, I've been doing this for 32 years, and it's my passion, it's my calling. Okay, are we back on there? We got this meeting is being recorded. Turn this off. Anyway, hope everybody can hear us. And so I've been doing this for 32 years, and it's been my mission and calling and stuff. And so I have a lot of wisdom and interest in this whole field, and I'll give you a little background on myself. But before I get started, I want to introduce with you my co-presenter, and I'll let her introduce herself to you.
Hello, my name is Norma Negrete. I'm one of the FPU students intern in MSW program. I'm in the first cohort as advanced standing. So it's a pleasure to be here and share with you guys my experience as a student as well.
So I thought it'd be an interesting dichotomy of somebody who's been in the field a long time. I'm a dinosaur, and to get the perspective of somebody new and fresh entering and considering a field of medical social work and their raw perspective. And so I enjoy having students, and I want to give disclaimer, kudos to Norma, who's done an amazing job, and she's helped put together most of the PowerPoint presentation, and she's also my tech support, and she's doing an amazing job in her internship here with me in oncology. In the survivorship program, and so more of that to come. Just real quickly, a little background intro about how I got into, how did somebody get into medical social work? Well, my mother was a nurse, and so she was the charged nurse. She was the manager nurse of the operating room down at Kaiser in Los Angeles on Sunset Boulevard. And so she wanted all of her kids, there's 6 of us, I have 5 other siblings, she wanted us all to go into the medical field. Well, in high school, I had one of my best friends, and I wanted to go into medicine. That was my goal in high school. I wanted to go into either to be a doctor or something in the medical field. But in high school, my best friend developed a mental health crisis. And to this day, he's a paranoid schizophrenic. And so it just really made me pivot to want to go into more of the mental health helping field. But I still loved the medical field. My mother would have me come in and sit in on surgeries just to be passionate about the surgeries and stuff. So I got to see a lot of fascinating things. Well, my sister went on to become a nurse. My other brother went into hospital administration business. My other brother is a PA, physician's assistant, and my other brother is an orthopedic surgeon doctor. So they needed a medical social work. So for me, it was combining the best of both worlds, medical and mental health or counseling and services. Norma, what allowed you, or what feels a calling for medical social work for you?
So for me, it was we had an incident in our family back in 1998 with suicide in our family. And so our social worker was gracious enough to support us and help us through. So when I saw her, I was like, I want to be her, I want to be that helping hand. So that's what promoted me to this career. And I just want to help people, and I want to be there for the people that need it. So I think this is a wonderful profession. And as I'm learning more, like my calling is even more higher. So yeah, I'm excited.
Yeah. So also a little disclaimer, Norma said that she's really, really nervous today, but she's doing a great job. So I told her I love having students have great opportunities like this in presenting on a bigger stage. She may be anxious now, but later on she's going to come back and thank us instructors, or field instructors, or classroom instructors for pushing them a little bit to have these learning opportunities of professional growth and development. And she's going to do a great job. Okay, so we're going to share our slides here. Give us a moment here. Okay, so we had our introduction, and that's our hospital at Valley Children's. I work here at Valley Children's Hospital. And so just a general introduction to social work in healthcare. So when you're thinking of healthcare, there's lots of different types of healthcare. So there's adult hospitals, there's children's hospitals, there's the veterans hospital, there's nursing home care, there's home health, there's hospice and palliative care, there's rehab. There's a lot of different types of healthcare. So when you think of social work in healthcare, it's not just medical in a major hospital. There's different branches, and I'll say this is the more macro overview. So social work in healthcare, we're trained professionals to deal with the emotional and social, financial, anything related to improving the well-being and promoting access to other resources to regain back. So then going on to a little bit more of a meso level of healthcare, social work in healthcare. Next slide. So when you think of, now this is just coming to a children's hospital. So here at Valley Children's, the role of any of our pediatric medical social workers, and we have over 34 full-time social workers here at Valley Children's Hospital. And we're all kind of, we can interchange and go anywhere, but we also are in specialty groups, kind of like we have specialty social workers that only work in the neonatal intensive care unit or the pediatric intensive care unit, social workers that work just entirely to the emergency room, or like myself, I work in oncology, hematology, oncology team. We have the acute team. Those are the social workers that work on the inpatient side of the different units. We have about 4 different or 5 different inpatient units. We have social workers that are on the ambulatory clinic team, and those are all of our outpatient clinics, like endocrinology for diabetes, or it could be plastic surgery, neurosurgery, cardiology, nephrology.
Alistair, I don't
yes.
want to interrupt, but we can't see your PowerPoint. You need to share your screen.
Oh, thank you. Thank you. Thank you.
Can you see it now?
You're muted.
Yeah, we can see it.
Okay, sounds good. Okay, thank you. I'm sorry about that. You didn't miss much. The only other slide was just one other slide that was just talking about the introduction to social work in healthcare. So thank you for that. So the role of the pediatric medical social worker, as you can see, This is all the different things that any of the social workers here can do. And of course, it's transferable to other agencies and other things. Like you're thinking, oh, I do that. Oh, I do that. Of course, we do a lot of similar things. And that's the beauty of, we love when we recruit other social workers. We love social workers that come from the CPS world, or come from school social work, or come from home health, or even criminology, or in mental health, because a lot of them are transferable. And so when you think of doing psychosocial assessments, most social workers at any agency at some time or another might have to do a psychosocial assessment. But we do a variety of different things. And as you can see, I think that's the exciting part of our job, is that we have so much a variety of interventions that we provide for our children and our families. And we also work alongside, as we refer a lot of these families out, we're collaborating with our school social workers, or we're collaborating with the CPS or welfare social workers. We're collaborating with work people that are in substance abuse or mental health, with therapists, counselors. So we're always collaborating with other social workers in other agencies. And I think that's the beauty of our work, is that we're collaboration and leveraging, brokeraging our community partners to help support the family. We come at it at a holistic approach of trying to find all the resources that can help provide that, not just emotional support, financial support, resources, housing, lodging, disabilities, basic needs, palliative care, discharge planning, and a lot of other issues and concerns. And so we'll go over a little bit more of these as we go deeper, but this is just kind of an overview scope of our practice that we do. So coming into a little bit more of a micro area about what I do. So I'm working with children, and I work with children with cancer. And so pediatric oncology, and that's what I've been doing for 32 years. So, but a lot of work that I do with oncology, it also resonates throughout the whole hospital. So when you're talking about a chronic illness, or talking about a disability, or talking about compliance, talking a lot about the emotional impact, the fears, the worries, the concerns, the anxieties, the depression, there's just a lot of emotional issues that go along with it. So just a quick background for a lot of people that don't know, that when children are diagnosed with cancers, and they always say, as a parent, I would say, I want nothing but the best for my child. I'll go anywhere. I'll go to the ends of the world. Just find me the best hospital that treats children with cancer. Is that Los Angeles? That's St. Jude's. How can we get down to St. Jude's? How can we go to Mayo Clinic? How do we go to Stanford or someplace else? So we let them know something interesting about with pediatric oncology is that all children diagnosed with cancer in the whole nation, we're all part of a consortium of care, that they all get the same protocol, the same treatment, no matter where they're at. So the kids right here in the Central Valley, here at Valley Children's, they get the exact same protocol. It's through this group called Children's Oncology Group. So they get the exact same treatment here as if they would down at LA or in San Francisco, or even at St. Jude's. So we tell the families, you're going to get the same treatment, which is the best treatment, right here in your backyard. No need to leave. And that's kind of encouraging. Now that's different than adults. Adult cancer care, some of the hospitals, they do their own research. And we feel that they do their own private stuff because they're in it for the money. And so for the children, we're not in it for the money. We're in it for the best outcomes for all children, regardless of ability to pay, regardless of where you're from or anything like that. So that's reassuring for them to know that. Now, to be honest, our hospital, we don't do some things here at our facility that we do refer our children out to. We don't do bone marrow transplants at this time. I don't know if many of you might have heard, is in the news. It was just announced a few months ago. We are going to start our very own bone marrow cell therapy transplant program in the next couple of years. So we're really excited about that. We normally send our children down to City of Hope, or Children's Hospital Los Angeles, UCSF, or Stanford for their bone marrow transplants. Now they get to stay home and have those transplants done here. So they're all on these treatment protocols. So cancer affects 1 in 300 children under 20, over 140 new cases here at Valley Children's. That's a lot of kids that we see. diagnosed with cancer. The most common cancers are the leukemias, brain tumors, lymphomas, solid tumors, and a variety. We see everything, rare diagnosis, unusual diagnosis. And so all of our doctors, we have about 13 hematology oncology providers here, do an amazing job. And so we're a very multidisciplinary team here. And that's the other great thing about medical social work is that you're not doing your social work practice in a silo. You're not doing it alone. You're here with a team. And we have a team of not only doctors, nurses, nurse practitioners, but of child life specialists, psychologists, nurse case managers, chaplains, volunteers, rehab, physical therapists, just a variety of teams. We also do what I'm proud of is that our team in oncology, we facilitate a psychosocial oncology team meeting every Thursday where all the teams, but the social workers, we run that show, and because we bring to the table our most challenging, difficult, psycho-complex families, or maybe a new diagnosis, or maybe an end of life, or maybe a family, a CPS referral, or a family dealing with a lot of conflicts or emotional issues and stuff. And we sit around the table and we talk about how we can all come together, how the left hand and the right hand are working together, the different disciplines, to approach and support the family the best we can. I'm going to put Norma on the spot here a little bit. We didn't talk about this, but I'm going to say she's attended, I'm in the survivorship program, so I don't attend those meetings anymore, but she's attended a few of those just to get the feel to see how the team works. And from the experiences that you've been on those psychosocial rounds meeting, what's been your observation and your experience from a social worker's point of view of seeing the multidisciplinary team coming together?
So it's very emotional. It's very emotional to see the doctors and all the staff work together. Um, this is the opportunity they take to talk about families and to grieve because there is some losses that they have. And during the meetings or the two meetings that I attended, they had recently lost a patient. And it's rare that you see a doctor emotional because, they prepare themselves to give the bad news or to help the patient. And just to be in those meetings and see all the emotions, it's with the doctor's care, but you never see them crying when they're talking to patients. So to have that opportunity to see them as human beings, they're doctors, they're well educated, but to see them as human beings, you as a social worker, it opens your eyes to it kind of gives you a different perspective of what the doctors go through and what staff goes through in general, because as social workers, we also have emotions and we also have to suppress sometimes our emotions to be there for the patients.
Mm-hmm.
So all these emotions just come out and you're able to talk about it with the team. So it's kind of like a counseling session. I told my professor, I go, it's kind of like a counseling session in there because, you're giving hope to each other. You're looking forward, but also you're grieving because you couldn't do anything for that child or for that particular patient. So those meetings were amazing. I learned a lot. I've learned a lot throughout my career, but this just internship has brought me to understand more about social worker and medical social worker. And I wish you guys can be in those meetings as students. It helps a lot.
Yeah. So it's really neat because, like Norma said, we get to see the other side of some of these providers, and it's a safe place to be vulnerable and to be able to share the grief and sadness too. And so allowing for there to be tears and stuff. And that's another role that us social workers play, is that we provide support to our staff too. And we understand compassion fatigue or vicarious trauma. We understand all those things that we do in counseling sessions with other family members and things, but we also are skilled to provide that support to our employees as well too. Now we have a more organizational support department that provides that too, but it's neat that that we can do that in a safe place and be vulnerable with each other and support each other. Okay, so moving on. So as you can see now, getting into even more of a micro in survivorship. So that's my world that I've been dealing with in the last 6 years. I've been in oncology all my life, but just recently I've had the honor to come help develop and support the survivorship program of oncology kids with cancer. And The cure rates over the last 50 years have really jumped up a lot. We're at like nearly 85% of kids diagnosed with cancer are going to be long-term survivors. And that's different than adults. So there again is another that psychoeducation that we do with families at the beginning, because when they hear the diagnosis, oh, your child has cancer, of course, the number one thing is my child's going to die. And so we have to educate them on the research. We don't give them false hope either. We talk about how very serious and difficult this diagnosis is, and any child has the possibility of not surviving their cancer. But we also give them the data and the research to say that 85% of our kids are survivors. Now, adult world to this day, it's still about a 50-50. So it is pretty serious. And, not everybody survives cancer. But when you think about 85 and nearing on 90% cure rate, that's amazing. And so the research is better and better to finding more targeted therapies, more different interventions for treatments, a proton beam therapy, the surgeries, and for the quality of life. It's just the advancement is just amazing. So it's really exciting to be about that. I have job security when you think about survivorship. So I have over 1,500 on my caseload, and I say, praise God, bring them more and more. That's really great. So when you think of, let's say we have 100 kids diagnosed with cancer, an 85% cure rate, that means 15 or so are not surviving. That's 15 too many. We average about 25 deaths a year in oncology. So that's still a lot of deaths. That's like 2 a month. So just to put that into perspective for that. We're dealing with, they say 2/3 of survivors experience at least one late side effects. And so just because they're cured doesn't mean that their cancer journey is over. They may have disabilities, physical disability, an amputation, or scars, disfigurement, so self-image issues. They may have just emotional post-traumatic stress from going through a lot of traumatic things, social anxiety, social fear, social awkwardness. We pull them out of schools. Learning disabilities, if they got radiation or some of the chemotherapy affects their cognitive, their ability to understand things. We go over fertility issues. Some of the chemotherapy, believe it or not, can destroy the eggs in women or destroy the sperm in guys to impact their reproductive health. So we go over a lot of education and talk about age appropriately, of course. I start like when they're 15 and above so that they can know that they should be using protection if they are fertile. So we want to educate them on that. We don't want them to assume. We've had some survivors way in the past get pregnant early, and they had the assumption, oh, I didn't think I could have kids. I had cancer and I had chemo. I heard or read or saw a movie that said I couldn't get pregnant, and said, hey, you never checked with us to find out the real education or learn the facts. So that psychoeducational part is empowering and helps them to make good decisions for their quality of life going forward. Okay, next slide. So some of the cognitive dysfunction that a lot of our kids with cancer may experience is that there could be complications from the therapy. Their blood counts was really low. The hemoglobin was really low when they presented at time of diagnosis. That could impact some of their organ failures, or could allow for a stroke, or could allow for infections that could be debilitating and life-threatening as well. Loss of IQ points. So we do with almost all of our kids a neuropsych eval at the beginning of diagnosis, just to get a baseline to see where they're at, and just to follow through and do a periodical updates of their neuropsych evals. There may be short-term memory loss, a decrease of attention. So that's where we work closely with the schools for IEPs, 504 plans, special education. We want these kids to stay on target, grade target, age target, the best that they can while going through their treatment. So we modify or adjust or work with the schools. Education is really important, and socialization is really important for them. And so that impacts their mental health, their emotional well-being, and their future outcomes for that. So that's really big. We spend a lot of time with that, help them to re-entry, reintegrate, communicate with the teachers, the school, how to make it a celebratory time for them getting back into the school. So then in survivorship, we do a lot of really neat, also part of my job is helping to develop programs and activities and events just to honor them, to engage them. Our motto in our survivorship is get connected, get involved, and give back. And we want them to have that mindset that as they think about what it means to be a cancer survivor, we want them to apply that to other aspects of their life, with their school, with their relationships, with work, with finances, with other conflicts, problem solving. So we're giving them opportunities at a young age about how to learn to do some of those things. And by giving programs or activities and stuff, it just helps to empower them and to support them and give them that extra step up. So in our survivorship program, we do a lot of different programs. We do our conference. We have a scholarship program. We even have done several years. We did a surfing for hope. Kids, we take them surfing, teach them how to go surfing out at Pismo. We spend the night out there, and that's a lot of fun. But learning risks, taking risks, but how to support each other, do something fun and adventurous. But it's more for socialization too. Have light the night, social roundtables, volunteer opportunities. We've made at Ronald McDonald House, we got our volunteers to cook a dinner to take to our oncology unit families, and just opportunities to give back, book club, paint night, and things like that. We just had our 9th annual survivorship conference just last month. September is Cancer Awareness Month, so we always do in September. And it was another success. So we had about 140 families, and this is for the siblings and the family. We really want to do as much for the family, and because, as we know, a cancer that impacts one person, it impacts their whole family, it impacts their community, their schools, and different layers beyond that. So we try to invite the whole siblings, the family, spouses, girlfriends, boyfriends, the whole family, and have a good time. This year's theme was rooted in resilience. And Norma had the opportunity to really help to engage and participate in this conference. Norma did an amazing job. She's like a program manager, which she really is. And she was troubleshooting. I said, Norma, we need this, we need that. And she was just taking control. She was calling our EVS people. She was calling maintenance. She was calling our IT person. She was calling our cafeteria people. She was on it. I tell you, I was thinking, dang, she's running this show here. So I just really appreciate Norma. She helped facilitate a breakout session with it was the younger survivors. So after we have our presentation, we have our speakers, we break up into breakout groups, and we have a group for the parents, we have a group for the older survivors, which I usually facilitate, and Norma helped to facilitate the younger survivors, under 15 survivors. And she had another social worker with her,
Yes.
One of our social workers here. But it's a neat opportunity for her to do a little group work and do some little group dynamics and other activities. I'm going to have Norma share what her experience from our students' perspective as a medical social worker doing a program that helps to support survivors.
So thank you. That opportunity made me grow. I mean, I've never done group sessions, so we had the opportunity to do group sessions. We had the kids experience the bad and the good. We had questions, activities for them, and just getting the feel of the children. All of them knew their social worker, and we had them share how important their social worker was in the process of survivorship. And they said that they all remember their social worker, how much they helped the family. One of the childs even shared that he got a check, from one of the social workers. Obviously, it was one of the foundations that they have, but he was so grateful because that social worker was able to alleviate some of the stresses that his parents were going through. So just to know that the kids are also looking at medical social workers as team leaders, and to know that we are making a difference. As social workers, we sometimes don't think that we're making a big impact on the children, but to know that these kids are really getting interest and really experiencing the impact that we're doing was so fulfilling for me. And it's just, I was a part of something, and it was great. The conference went great. It was my first conference. I had never experienced a survivorship conference. So that at that point, I was just amazed of everybody who showed up. And, the warmness that it felt. I mean, these people went through life-threatening situations, and sometimes we don't understand how big of an impact that can be for the kids, especially at a young age, and you're making a difference and you're there to support them and you're walking them through. So that was very impactful for me. It was a learning experience. It was an experience that I want to continue, and I even want to be a volunteer for next year's, because it's just amazing. The atmosphere is just amazing to feel. So thank you for that opportunity.
Absolutely. See, she's going to be a speaker too, maybe a future adjunct professor. You never know. Okay, another event that we just did just this past Friday, just fresh off the press here. We partner with Leukemia and Lymphoma Society for the Light the Night event, and it's for all cancers of all ages. So it's the whole community coming together to celebrate, to honor all the survivors, and to honor the family and the supporters, and even to honor those who may have lost a loved one, somebody who may have died from cancer. It was at Chancey Park, and there again, Norma got to help out. Valley Children was a corporate sponsor of this event. The Fresno Truck Center Childhood Cancer Survivorship Program was a supporter of the backdrop photo drop, and also to help support some of our kids with scholarships. Our own Dr. Razaki and Dr. Chang were the honorary chair people for the Walk the Night campaign event. And so they got to speak. They were like the MCs. But it was just really powerful to see all the survivors that come. They get a shirt that says survivor on their t-shirt, and they carry the white lanterns. And they all meet in the middle, and they tell them all to turn on their white lanterns at the same time. And that thing just gives me goosebumps, just to see all these survivors, the power of survivors. And then all the family, the siblings, the parents, the relatives, and supporters, they turn on their red lanterns to show the support and love that surrounds them. And then there's a few yellow lanterns for those in memory of somebody who may have died. And so we still remember them. The legacy of remembrance is powerful, and just to be able to provide that. And we do this every year. And so it's just really neat for our families and partnering with our community to let them see that we continue to acknowledge them and honor them and support them. Any quick highlights from Light the Night event, another activity you got to help? And Norma was great with the planning and helping, being at the table, manning our own table, Valley Children's. I don't know if some of you might have gone and was there. And so if not, come again next year.
Yes, it's a great event. And just they just do a walk towards the end. And that walk, you just feel the atmosphere of everybody there, being cheerful and being grateful, even remembering somebody, that's their way of honoring that person. So it was a great event. And we got free coffee, so that's even better.
Dutch Bros.
It was very cold, so we got free coffee. So that was a really big highlight. No, but it was a great event, and we had a lot of families come.
Yeah, very good. Okay, we're going to move on a little bit, talking about, we want to talk about the integration of spirituality and social work. So as you know, what I really appreciate about Fresno Pacific University and their teachings in the social work department, and as myself as an adjunct professor, getting the opportunity to integrate spirituality into our field of work, our field of practice, which I think is a vital part of our bringing our Christian point of view perspective into our social work practice. And so just a few, you can read the things that are on the slides, the definition of spirituality and why we integrate spirituality into social work. Clients find comfort in healing, holistic care. And I think it starts with training and teaching our students how to respect the diversity of different beliefs and the role that spirituality plays in healing or in the hospital and all. And it just draws strength from their spiritual religious beliefs to empower decision-making, resilience, and recovery. I have a really neat saying from the North American Association of Christians in Social Work, NACSW, their assumptions listing that they've come out with. And what I really like is that it states, as a Christian committed to the dissemination of what I believe to be the truth, my task as a social worker is not so much to convince others of this truth as it is to provide them with the experience of being loved, forgiven, and cared for, so that the good news that I believe in may be a credible option for them. So it's not like we're proselytizing or we're converting or we're imposing our own beliefs, but it's doing that compassionate care and empathy, stuff like that, that kind of is a transferring of our Christian beliefs for that. Have a really neat article It talks about, it's from Jerry Joe Gilham, and it talks about the ethical use of supervision to facilitate the integration of spirituality in social work practice. Just want to read a few things. What I love about this article is that one of the authors or researchers that they cite from was my old professor from the University of Kansas, and I took his class of social work and spirituality. So it's kind of neat to see his work being published and being used as a credible source for them. But just want to read 2 or 3 little highlights from it that just is to encourage all social workers in whatever field you are, the importance of integrating that into your assessments, your support, and just, I'll read it to you and then I'll discuss a little bit. It says that the Code of Ethics, NASW, mandates that social workers obtain education about and seek to understand the nature of diversity and oppression with respect to religion. The current Council on Social Work Education, CSWE standards, requires schools of social work to demonstrate their commitment to diversity throughout their curriculum. Ed Kanda says that spirituality, he says that he defines spirituality as a search for purpose, meaning, and connection between oneself, other people, the universe, and the ultimate reality, which can be experienced within either a religious or a non-religious framework. He says that a national survey of professional social workers revealed that many social workers find it acceptable to use spiritually related interventions with clients, and a majority of workers admit to using spirituality as a resource for clients. He said that most therapists do not regularly assess clients' spiritual issues, nor are these issues part of their treatment planning for clients. This tendency might neglect to identify resources and issues that might otherwise be important. He asserts that opening a conversation about spirituality or religion depends more on careful listening to spontaneous sharing than knowing what questions to ask. He also says therapists who avoid discussion of religious issues, they miss the opportunity to help patients integrate their religious and emotional selves. Those who focus their attention on religious issues risk losing sight of their therapeutic tasks. He states that when a practitioner does not ask a client about religion, that he or she is actually isolating religion rather than being neutral or objective. There may also be countertransference issues by the therapists themselves. So he says many practitioners feel they did not receive adequate training through their academic program to integrate spirituality and faith in clinical practice. So efforts are being made to incorporate formal training that are slow and limited, and research has revealed that schools of social worker have not met the call to prepare social workers to integrate spirituality in practice. I say that because I'm proud of Fresno Pacific University doing an excellent job, I feel, of integrating spirituality in a lot of their writings, their work, their papers, their research, whatever, and just to give them that background. And you can tell the difference between those social workers who have that formal education training of how to do that, that they are, I don't know, more well-rounded. They can hit on that source of support for the family. Even if they lack that themselves, I think all social workers just need to have that understanding. It's not about them. It's about finding out where the family or their client is with that. There's a lot of really neat, at our hospital, well, before I get to our hospital, really neat assessment tools. There's a lot of different assessment tools for how to do spiritual assessments from a social work perspective. There's one called the Hope Assessment Tool, just talking about what's your source of hope. What are your sources of hope, strength, comfort, and peace? What do you hold on to at difficult times? What sustains you and keeps you going? For some people, their religious or spiritual beliefs acts as a source of comfort and strength in dealing with life's ups and downs. Is this true for you? If not, where is your source of hope? Talks about other different things. There's another assessment tool. It's called the Spiritual History Assessment Tool, or the SPIRIT tool. It talks, S is for spiritual belief system, P is for personal spirituality, I, integration with spiritual community, R, ritual practice and restrictions, I, implications for medical care, T, terminal events for planning. There's also another one called the FICA Spiritual History Tool. FICA, F-I-C-A. F is for faith and belief. Do you consider yourself spiritual or religious? I, importance. What importance does faith or belief have in your life? C, community. Are you part of a spiritual or religious community? Is this of support to you, and how? And then A, addressing care. How would you like me or your healthcare provider to address these issues in your healthcare? So there's a lot of really powerful incidents of how, when you find out a person's spiritual background, how that can become used in part of your clinical work with them. It's 12:40. We're doing good on time. I got 10 minutes. I want to quickly tell you about Jasmine. Jasmine was one of my patients, and real quickly, I'll do this in about 3 or 4 minutes. Jasmine was diagnosed with a very rare and very aggressive cancer down at another hospital in Southern California when she was visiting family, and they gave her a poor prognosis, told her that there's nothing they can do and that they were going to refer her to hospice and for her to go back home, and she lived here in the Central Valley, to go home to die. Well, she and her family were very discouraged by those news, and they wanted to come to Valley Children's Hospital for a second opinion. They came to us, and to be honest, we told her the same medical findings of that. We did the CT scans, we did everything, said, yes, the doctors down in LA were exactly right. You metastasized to your brain, lungs, liver, it's everywhere. And your prognosis is very poor, but we offered her hope to try some chemotherapy to help with quality of life and help with pain management. She wanted to do that. Long story short, she went a whole year of getting chemotherapy, and finishing the whole year out, was able to graduate from high school, and she was able to go to her prom. She got enrolled into college, and she wanted to major in social work. And then her cancer came back with a vengeance, and she ended up, long story short, she ended up passing away from that. But she was my patient, and I had wonderful visits with her, and she was very religious. Her faith meant a lot to her. So we talked about that, her faith, talked about the meaning of that for her, to give her hope beyond her diagnosis, hope beyond this life, hope beyond illness, and what it means to be living even amidst while dying. And so powerful times of therapeutic interventions, even to the point where, with her permission, her mom's permission, to share scripture with her. And there's a powerful scripture that I shared with her from Psalms 116. And it says, I love the Lord, for he heard my cry. He heard my cry for mercy. Because he turned his ear to me, I will call on him as long as I live. The cords of death entangled me. The anguish of the grave came upon me. I was overcome by trouble and sorrow. Then I called on the name of the Lord. O Lord, save me. The Lord is gracious and righteous. Our God is full of compassion. The Lord protects the simple-hearted. When I was in great need, he saved me. Be at rest once more, O my soul, for the Lord has been good to you. For you, O Lord, have delivered my soul from death, my eyes from tears, my feet from stumbling, that I may walk before the Lord in the land of the living. The mom called me the day after she died at home and said that she shared that scripture verse, because mom was saving that scripture verse for her. The mom shared that scripture verse with her as things was getting nearer. And Jasmine smiled and told her mom, I get it. She had a tear, a smile on her face, and she died 2 hours later. She was at peace. Mom sent me a powerful thank you note that I always cherish. And it says, Alistair, you were an inspiration to Jasmine. She had the dream of becoming a social worker because of you. Even though God decided something else for her, I want you to know Jasmine was at peace and accepted God's calling. I thank God we met you, because you have no idea what your prayers and words meant to our family. We found peace with her illness, and she lived life to its fullest. Jasmine's mom. And that's the power of that. We have an opportunity to integrate our spirituality into some way to provide hope for them, or show God's love, mercy, grace, and all those things. Okay. It gets emotional. That's an emotional thing, but that's some of the difficult work that we do here. So what inspires me to do this kind of work that we have here? And like I said, it's not cut out for everybody. And I get it. We have social workers that come here and after 3, 6 months, 9 months, or a year, they say, I can't do this work. It's really intense. And it is intense. And it's really important that we take care of ourselves. We find meaning outside of our work. You know, that work-life, I don't call it balance anymore, it's work-life integration, how to integrate your outside life. And we talk about the importance of your personal life and your professional life coming together. And so you have to examine your goals. You have to examine the meaning of your work. Both, oh, and I apologize for the screen. I know it has the text in there. We meant to leave it blank. We forgot to take that part out. So that's on me. So Norma didn't do that. So we understand there should be things in there. So disregard that. But when you're thinking about medical social work, you have to think about examining your goals and your purpose and why do you want to do medical social work? Do you enjoy the challenge? Do you enjoy the variety? No 2 days are ever alike. It's always different. And ask, should I move on? Or ask, why do I stay? And ask, why would I move on? And those things can get you to think about more the purpose of the call. And like I said, I feel this is my calling. This is my ministry. This is my mission field. I love what I do. Hard work, tiring work, but I enjoy that. I like that. I went to my conference, and this is the last thing as we wrap up here. And I'll have Norma share a few words about her experience here too. But what inspires me, when I went to my conference, my APOSW conference, I go every year and I learn so much from them. It helps me professionally to keep sharp on my clinical skills. But one of the social workers there challenged all of us to go home or on the plane or on, you drive home, whatever, think about and write down what inspires you to go on to be a pediatric oncology social worker. So I had to give it some thought. I thought about some of the things for me personally. And here's just a few thoughts that came to my mind. I say, being a small part of the transformational journey of children and families affected with cancer inspires me. I'm inspired when I see the resilience of families and children battling cancer to never give up. I'm inspired to see the list of cancer survivors growing every year. I'm humbled and I learned life lessons from families enduring emotional and physical suffering. I'm inspired and I'm humbled in having a couple of my former patients and parents go on to become social workers because of the work relationships we as social workers had with them and their families. I am inspired by seeing miracles happen of kids beating the odds or come back to do well when they were knocking on death's doors. I'm inspired by how a child with cancer can impact and move the hearts of the most hardened hearts of men and women. I'm inspired by learning that it's not the years in our lives that matter, but it's really the life in the years we have that God gives us that matters. I learned to live life to its fullest each day, as I may not be here tomorrow. I'm inspired by the simple, pure, unadulterated joy and laughter these children can have when going through their cancer treatments. And I'm inspired by the profound, unconditional love a parent has when sitting or lying by their dying child. I'm inspired by the positive impact some parents have to give back after they have lost their child to cancer and are able to leave a living legacy in honor of their child. I'm inspired by my God who has blessed me with the spiritual gifts to help serve, counsel, show mercy and grace to his children, who has given me a hope beyond measure. And these are just a few things that come to mind that inspires me. I would hope everybody would have that opportunity to think about what inspires you in your own field of work, whether it's at whatever agency you're at or whatever clinical practice you're doing or academic teaching or work you're doing, and how God can use you to do his work, his kingdom work here on this earth. So I want to turn over to Norma to share from a social work perspective, intern perspective, I don't know what it means for you to be doing your work here. And she's only here, this is first semester. I can hardly wait for second semester. She's got a lot doing here.
So to be honest, I was a little scared coming into my internship. I didn't know what to expect as a student. I did my bachelor's back in 2020 when COVID hit. So it was a little scary to come in. But I came in with objectives to learn. I wanted to learn. I wanted to become the best social worker. I wanted to get a background on, and you know what? I have a lot of shoes to fill because Mr. Alistair is a great teacher and a great professor and a great person in general, and very opened up to me as a student to ask any questions um, or any doubts that I have to go to him. But just being a student social worker, I get to experience what his journey has been, and I think that helps me kind of mold me to what I want to be. And I think I want to be a social worker in the medical field. Um, and just seeing all the stories, just being able to help a family, like as he said, just a little bit, because you're not going to alleviate everything, but you're going to help them just a little bit. Going through a life situation, a change, and then just putting your own family, because I have children too, so I can't imagine what these families are going through, but I can see their struggles, and I can understand their struggles now, which I didn't understand. And honestly, since I've started my internship, like my whole perspective of life has changed. It's been that impactful in my life, because you just don't understand until you're right ahead of you. You don't understand why things happen. You don't understand the roads. But now you see them clearly because you're there. You're firsthand. You're seeing these families go through situations that you could never imagine going through. And when it's inspiring, you want to be able to help them. And being a social worker, you get resources for them. You try to get as many things as you can for them, just to alleviate a little bit of their pain. And with the graces of God, they become survivors, and then you can be in their happy pattern. Because I've seen being in the beginning pattern of the situation where you get diagnosed. I was with a patient who still didn't know what her diagnosis was, but the family was already preparing everything. And there was just so much emotion in that room because they really didn't know the diagnosis, to where a patient was already diagnosed a month ago and he was already getting treatment. And then you come to a survivor room where the patient already went through the whole situation. So, like he said, you just never know what you're going to get that day. And I think that's what makes the excitement, because you don't know. And with the grace of God and with the help of God, because let me tell you, I pray every time I go into a room to make sure that I'm doing the correct work. Just knowing that you're going to help them a little and you're there to comfort them, that inspires me. I'm sorry.
Okay.
When it comes to religion, I think this hospital is amazing. They have a chapel, they have religious beliefs for all patients. They provide education, they provide support. I mean, you tell them what religion you have, and if they don't have somebody here, they will contact somebody for you here, and just have them come and be with them. They have contact persons outside of the community that can come and support them. So I think that's a major support in this hospital that other hospitals, I'm pretty sure, don't offer. Um, and just for the families to know that their spirituality and religion is going to be respected as their child are going through treatment, I think is a major help and a major step. And I thank God every day because I get to go to mass on Fridays. I hear mass here at the hospital, and it's amazing. And I can see the different families coming. And we have a family that goes and prays at the chapel because they have certain prayer times, and it's available for them. And other hospitals will not make it available. So I think that's a great opportunity that Valley Children's has for those families. So I thank them for that.
Super. Hey, I don't think we can end it off any better than that. And hey, I want to give great shout out, kudos out to Norma. Isn't she amazing? And so this is the product that I get the blessing of getting these amazing students from FPU, and I'm so grateful for the MSW program, the accelerated program. I have such quality professional people. I know some of our professors are watching, Sonia, Edgar, John, so I mean, I couldn't be any happier for that. So that's all that we have. I don't know if there's any questions anybody may have for us. I know we want to wrap things up here soon, but thank you very much for letting us share our perspective of that. You can tell we're excited and passionate about what we do.
Thank you so much, Alistair. We do have a few questions, and thank you, Norma, also. The first question is, how do you volunteer for these events? Dora says, I love what you guys are doing. God is good all the time. Thank you for sharing.
Yeah, we take volunteers, and we have an email that we say, hey, these are some of our events that are going out. Now, to become a formal volunteer at Valley Children's Hospital, it is difficult. We have a volunteer office and department, but talk about background checks and screenings and everything. I think it's harder to be a volunteer than to be an employee. And you got to commit. You have to be a volunteer for a year, put in so many hours a month. It's like almost like a job here. So our volunteer department is pretty rigorous. But if you wanted to help volunteer for some events or programs and stuff, you can just contact that department or they say, hey, when you have an event, I'd like to, you need any help or to volunteer for like a one-time event or stuff like that. We don't mind. And our survivorship will take any help we can get. So we're inclusive, not exclusive.
Mm-hmm. Okay, thank you. Patricia asked, what types of self-care do you practice? And how does Valley Children's Hospital support self-care on the job?
Oh, yeah, Valley Children's, I'm so grateful. We have our EAP, that's our employee assistance program, that any employee can get free therapy, I think like 3 or 4 sessions from a licensed clinical social worker or counselor, or family and marriage counseling. So we provide that. We have another thing called
a massage therapist.
Yeah. We have a massage therapist. That's a big hit.
Yes.
They go around, or you can pay, I think it's like $10, $15 for like a half-hour massage therapy right here at the hospital at work. We have our chapel. Self-care for me is I have an amazing wife. I'm really involved in my church. I serve on my church board. I go on missions. I help with the youth. I do men's ministry, and then I love to travel. So self-care, that is really, really important. And so I work hard, but I play hard and I rest hard. And so I think and so that really, really is important. So I say you got to find stuff. I get involved with healthy children outside because I work with sick kids. So that's why in my church I help out with the youth group, or I help out with missions, or I help out with other healthy people. So you got to get a balance of some of those things. How about you, Norma? What do you do for self-care?
Well, for right now, it's a little hard because I do work full time and do internship and excuse me. And but I do practice faith. Excuse me. I go to church every Sunday with my kids. I try to be with my family as much as I can. And just prayer right now is just major prayer to get by. Go ahead.
Sorry.
Excuse me.
She gets all choked up. She gets so excited. No, she's been talking. Hey, I see somebody's email from Evelina Castillo saying, can we get emails from the speakers for more information? Absolutely. So Kim or John, if you want to send out our emails out to people, they're welcome to email me directly. You have my email, and I'll be glad to answer any questions that people may have individually. Oh, I love that resilience coordinator who supports employees. Yeah, that sounds great. Yeah.
So we have one last question. A student is enrolled in junior college right now, but really wanting to think about moving into this field of pediatric oncology. What are the requirements to work in this field? What kind of degree will they need?
Yeah, here at Valley Children's, all of our social workers are MSWs. So you need an MSW. We're willing to do BSW social work field internships here. So we have done, I've always taken Fresno Pacific bachelor students before they had the master's. Now I really like the master's program because they're a lot more advanced and able to do it. Norma does psychosocial assessment. She goes in, she sees patients on her own now. She's doing great counseling and, of course, consultation before and after, and really close things. Anything comes up right there by her side and stuff. But bachelors can do their internship here. We're only taking students from Fresno State or Fresno Pacific. We used to take some from outline or online programs, no longer. We want to keep it just to those 2 programs.
All right, thank you. Dr. Clark, you want to finish up?
Yes, I just wanted to say thank you to everyone for coming out today and for our speakers and just for all the things that were, that we learned and yeah, for the stories and how we can integrate our faith because that's an important thing of why of why we do things, and understanding the why and having a mission and a purpose and a reason for what we do. I think that's so important. And Alistair, you've always been inspiring to me and to many of our students, and for your passion for what you do. And just thank you for coming out and sharing with us.
I appreciate it, Dr. Clark.
Thank you.
Appreciate it. Thank you.
Yes. All right. Well, thank you everybody for coming and have a great day. Okay.
Thank you.
Thank you.
Thank you, Norma, too. Appreciate it.
Thank
It was
you.
awesome. You did a good job.
Thank you.